Hi guys, just want to give a quick update with how I'm doing after my ACDF surgery. So I did break my C1 in 4 separate places. Then I had anterior cervical depression and fusion in my C6 and 7. That's what the ACDF stands for. And I've noticed a lot of the videos on YouTube talk about like the post-op, and it's great. But they don't necessarily go into detail about which exercises you're going to be doing in your physical therapy. So I haven't started physical therapy yet. I have an appointment with my doctor in 2 days, and then I will be going to the VA for my physical therapy. I'm a veteran, and the VA can be a great benefit. Fingers crossed I get a very good physician and a physical therapist to help me out with my situation. So I'm like Googling and YouTubing, physical therapy exercises post ACDF surgery, and I'm seeing a lot of yes/no exercises, which, let me remind you, I am a personal trainer, been training for 8 years now, and I am certified as a corrective exercise specialist. So I don't just put people through like a grueling, intense, hard workout that makes them sweat and throw up. I am looking for muscular imbalances and postural deviations. If somebody's sitting all day at a computer and they're like this, I'm not going to have them do squats or deadlifts because their form is going to look like crap. So what we need to work on is stretching the chest while strengthening their back, their rhomboids, their rear delts, their traps, so they can be in a better position for squats. I wonder what this physical therapist is going to have me doing. And all I'm seeing is this yes/no exercise, which basically you're going to go back as far as you can until it's uncomfortable, and then you go down. Then you go back nice and slow until it's uncomfortable, and then you go down. So you do that 10 times. Then you're going to go for the no exercise, which obviously you're just going to go, no, I don't want to be doing this, but I'm going to do it anyways because it's supposed to help my range of motion. So as you can see, this is as far as I'm going right now. And as soon as I get here and I slowly move over, that's where I'm hearing, like, I don't want to call it crunching, but just a little teeny tiny, like pop rocks almost. After a surgery, you have inflammation and lack of movement. So lack of movement means you have less blood flow to the area. If you don't have that much blood flow, then you're not going to recover as quickly. I saw a video where a doctor said, after your surgery, still stay mobile. Walk around your house, or if it's a nice day outside, just walk around outside. You want to make sure that you're increasing that blood flow. Secondly, I've talked multiple times in my videos about my E-stim or my TINS unit. So obviously that's just like electro-stimulations. I put the padding on the back of my neck, and it does like a pulsing where it actually flexes the muscles for me. That's another thing I highly suggest that you do. And I'm making this video because I'm going into my physical therapy completely blind. I don't know if this professional is going to have me do like yes/no, or I also saw a video where there was like this hook that looked like this that came down with like a rubber arm, and the girl put her forehead on the arm, and she was supposed to be tilting this way. So it's like nice and slow. You kind of want to do like 1, 2, 3, 4, 1, 2, 3, 4. Then she faced this way, and she's like 1, 2, 3, 4, 1, 2, 3, 4. Obviously, you repeat on this side, and then you're going to repeat going backwards, and all you're going to do is like that, kind of like that yes motion. So it's not like a very strenuous exercise. It's more or less just like working on that range of motion. And even though this might seem extremely redundant, or you're like in front of your doctor thinking, what the hell am I doing here? I promise you, just by working this profession, it's going to work. It's going to help. So just stick through it. I'm going to be updating with my physical therapy what exercises my physician is having me do. So if you notice, this doctor right here is working traction and rotation with the neck. So he's having his colleague pull her shoulders down, which are going to keep the scapula from raising. Then what he does is he cups one hand behind her neck and he puts one hand on her chin. And what he's going to do is he's going to slowly rotate her neck until it reaches the tight point or the range of motion at the very end. Then he's slowly going to rotate the neck back, and then he readjusts his hand placement so his left hand cups underneath the neck. Then he grabs onto the bottom of the chin very lightly, and then he's going to tilt and rotate the head to the right. So this is basically like a active stretch. I do this a lot with my clients. If their hamstrings are tight, I'm going to lay them on the massage table and put their foot on my shoulder blade and lean forward. So I am actually stretching the muscle actively versus them statically stretching it on their own. And I'm sure the physical therapist is going to have me doing this as well. I'll be sharing all of that with you guys. So of course, anything that my doctor gives me to do, it's going to be specific to my injury. So keep that in mind, that if I had a broken C1 and then a fused C6 and C7, so maybe if you had like a C5 through a C7 fusion, your doctor wouldn't have you do those same exact exercises. But I'm still going to share that with you guys anyways, because I didn't really see a lot of videos. You know, people are talking about their experience, but they don't give like specific exercises, reps, or sets, or anything like that. So I want to make sure I provide that to you guys. So stay tuned for my other videos. You know, if you're going through something similar, or maybe this just happened to you and you're on YouTube looking for answers, I am making this video for you because I legitimately was in your shoes at one point, desperately searching for answers on YouTube, people I could connect with, looking at Facebook groups, and I'm here for you 100%. You can add me on Instagram and share your story with me. You can add me on Facebook and share your story with me. But you can also contact me through my website. It's bodybybrooke.fit. I would love to hear from you guys. I actually had a girl reach out to me who was in the surgical halo and said, hey, I saw your video on how the pain meds make you overweight and you need to really be careful on what you're eating. I'm also a certified nutrition coach through 2 different certifications, and I have gone to school and taken multiple courses on nutrition and sports nutrition. So I would love to help you get through this, because the last thing you want to do throughout your injury is gain weight. You want to be focused 100% on recovery. You don't want to look at yourself in the mirror in the halo and just see that you're gaining weight. So please visit my website, send me a message. I would love to help you. bodybybrooke.fit. The Brooke has no E. So I hope I was able to help some of you today. I know this video wasn't super informative. I didn't show you any exercises, but I did kind of reveal some of the research that I found. I hope you guys have a great day. Thank you so much for listening. Thanks for watching, liking, subscribing. I'm here for you 100%. This is exactly why I started this channel. So thank you so much for supporting me just as much as I support you. Comment below if you have anything you'd like to say, comments, questions, concerns. I absolutely love when you guys write on my comment section. I love engaging with you guys. All right, have a great day. You can also follow me on Snapchat or Instagram. I will follow you back.